Vaginal cancer is a rare type of cancer that occurs in the vagina, the muscular canal that connects the uterus to the outside of the body. It accounts for a small percentage of all gynecological cancers. Vaginal cancer can develop in any part of the vaginal lining and typically grows slowly. It is often diagnosed in its later stages because it may not cause symptoms in the early stages. Types of vaginal cancer: squamous cell carcinoma, the most common type of vaginal cancer, accounting for about 90% of cases. It begins in the squamous cells, which are the thin, flat cells lining the surface of the vagina. Adenocarcinoma, the rarer form of vaginal cancer that begins in the glandular cells of the vagina, which are responsible for producing mucus. This type can sometimes be linked to diethylstilbestrol exposure during pregnancy, the drug given to prevent miscarriage from the 1940s to the 1970s, but no longer used. Melanoma, the rare form of vaginal cancer that originates in the pigment-producing cells melanocytes of the vagina. Sarcoma, this type of cancer arises from the connective tissues in the vagina, such as muscle or fat cells. Sarcomas are much less common in the vagina. Causes and risk factors: the exact cause of vaginal cancer is not well understood, but there are several known risk factors. Human papillomavirus (HPV) infection. Persistent infection with high-risk types of HPV, particularly HPV 16 and 18, is a significant risk factor for vaginal cancer. These are the same strains of HPV that cause most cervical cancers. HPV-related vaginal cancers typically occur in the upper part of the vagina closer to the cervix. Age. Vaginal cancer is more commonly diagnosed in women over the age of 60, though it can occur in younger women, especially if they have certain risk factors. History of cervical cancer. Women who have had cervical cancer are at higher risk for developing vaginal cancer, as both conditions are related to HPV infection. The exposure. Women who were exposed to synthetic hormone in utero may have an increased risk of developing vaginal cancer, particularly the rare form called clear cell adenocarcinoma. Weakened immune system. Women with a weakened immune system, such as those with HIV or those on immunosuppressive drugs, have a higher risk of developing vaginal cancer. Smoking. Smoking increases the risk of developing vaginal cancer, as it is linked to other HPV-related cancers and can weaken the immune system. History of vulvar or anal cancer. Women with a history of vulvar or anal cancer are at an increased risk for vaginal cancer. Symptoms of vaginal cancer in its early stages. Vaginal cancer may not cause noticeable symptoms, but as the cancer progresses, symptoms may include abnormal vaginal bleeding. This can include bleeding after intercourse, postmenopausal bleeding, or spotting between periods. Pain during intercourse. Pain during sex. Dyspareunia is a common symptom. Unusual vaginal discharge. A watery, bloody, or foul-smelling discharge may occur. Pelvic pain. Pain in the pelvic area, which can be persistent, may be present as the tumor grows. Lumps or mass in the vaginal area. The lump or mass can be felt during a pelvic exam, though this is often seen in more advanced cases. Urinary or bowel issues. As the cancer grows, it may press against nearby organs, leading to urinary problems, e.g., difficulty urinating, or bowel issues, e.g., constipation. Swelling in the legs. If the cancer spreads to the lymph nodes, it may cause leg swelling or discomfort due to lymphatic obstruction. Diagnosis of vaginal cancer. If vaginal cancer is suspected, the following tests may be used to confirm the diagnosis. Pelvic exam. A thorough pelvic examination is often the first step in diagnosing vaginal cancer. The doctor may be able to feel abnormal lumps or areas of concern. Colposcopy. A colposcopy involves using a special magnifying device to closely examine the cervix, vagina, and vulva. This procedure may also include taking the biopsy of suspicious areas for laboratory testing. Biopsy. The sample of tissue is removed from the vagina for testing to confirm whether cancer cells are present. The biopsy is often performed during a colposcopy. Imaging tests. CT scans or MRI scans may be used to assess the extent of the cancer and whether it has spread to other areas of the body. PET scans may also be used in some cases to detect cancer spread. Cystoscopy or proctoscopy. If the cancer may have spread to the urinary tract or rectum, these procedures may be done to examine the bladder or rectum for signs of cancer. Staging of vaginal cancer. Staging refers to determining how far the cancer has spread in the body. Vaginal cancer is staged based on its size, location, and whether it has spread to nearby lymph nodes or other organs. The stages range from stage 0 in situ, or localized, to stage IV advanced disease. The stages are as follows. Stage 0 in situ. The cancer is confined to the surface of the vaginal lining. Stage I. The cancer is localized to the vagina but may have spread to the tissues beneath a lining. Stage II. The cancer has spread to nearby tissues but has not yet reached the pelvic wall. Stage III. The cancer has spread to the pelvic wall or nearby lymph nodes. Stage IV. The cancer has spread to other parts of the body, such as distant organs like the bladder, rectum, or lymph nodes outside the pelvis. Treatment of vaginal cancer. Treatment for vaginal cancer depends on the stage of the disease, the type of cancer, and the overall health of the patient. Treatment options may include surgery. For early-stage vaginal cancer, surgery may involve removing the tumor, and in more advanced cases, the vaginectomy, removal of part or all of the vagina, may be necessary. Pelvic lymph node dissection may also be performed to remove any lymph nodes that may contain cancer cells. Radiation therapy. External beam radiation therapy or internal radiation therapy, brachytherapy, may be used, especially if the cancer is in an advanced stage or cannot be completely removed through surgery. Radiation may also be used as adjuvant therapy after surgery to destroy remaining cancer cells. Chemotherapy. Chemotherapy is less commonly used for vaginal cancer, but it may be recommended in cases where the cancer has spread beyond the vagina, or in combination with other treatments like radiation therapy. Targeted therapy. In some cases, newer therapies that target specific molecules involved in cancer growth may be used, although this is more common for advanced or recurrent cancers. Immunotherapy. Immunotherapy, which uses the body's immune system to fight cancer, is being explored for some cancers, but it's not yet a standard treatment for vaginal cancer. Prognosis. The prognosis for vaginal cancer depends on several factors, including the stage at diagnosis, the type of vaginal cancer, and the patient's overall health. When caught early, vaginal cancer is more likely to be successfully treated. However, if the cancer has spread to other parts of the body, treatment may be more challenging, and the prognosis may be less favorable. Prevention of vaginal cancer. While there is no sure way to prevent vaginal cancer, certain measures may reduce the risk. HPV vaccination. The HPV vaccine can help protect against high-risk strains of HPV that are associated with vaginal, cervical, and other cancers. Vaccination is recommended for both girls and boys, typically starting at age 11 or 12, but can be given up to age 26 or beyond in some cases. Regular gynecological exams. Regular pelvic exams and pap smears, if applicable, can help detect precancerous changes in the cervix and vagina early, which may reduce the risk of developing vaginal cancer. Avoid smoking. Smoking is a known risk factor for several cancers, including vaginal cancer. Quitting smoking can help reduce the risk. The exposure. Women who were exposed to DIG while in utero should inform their healthcare providers, as they may need closer monitoring for vaginal cancer. Conclusion. Vaginal cancer is a rare but serious condition that requires early detection and prompt treatment. Women should be aware of risk factors such as HPV infection, smoking, and a history of cervical cancer, as well as any unusual symptoms such as abnormal bleeding or pelvic pain. Regular gynecological check UPS and HPV vaccination can help reduce the risk of vaginal cancer, and early diagnosis improves the chances of successful treatment. If you're someone who knows experiencing symptoms or has concerns, it's important to consult a healthcare provider for proper evaluation and management.